Hi guys, today we are discussing African horse sickness, which is reoviral disease. African horse sickness is a devastating disease that causes great suffering and many fatalities and many death cases in horses of Sub-Saharan Africa. It commonly affects horses, mules, donkeys, and is a deadly, highly infectious disease. Reoviridae family, Orbivirus is the genus, and African horse sickness virus is the species. So these are the properties of reovirus divided into 10 to 12 segments. This is the best reason for genetic reassortment, and this should be learned 10 to 12. So the synonyms are equine plague because most death is caused in equines by African horse sickness virus. And Dunkop and Dikkops are the two clinical forms. So they are also called as the synonyms of African horse sickness. Susceptible hosts are mainly horse, mule, donkey, zebra, etc. Elephants, camels, and dogs can be infected, but they will not be showing any symptoms and all. They will be acting as a just carrier, and they can even shed more amount of virus in the urine. Also, dog can get infected by eating infected horse meat. That's Shevon. Transmission is actually culicoides tick. We have also learned about the blue tongue virus, which is transmitted by culicoides and get affected for the large and small ruminants. So here it is not a zoonotic disease. Incubation period is 7 to 14 days, but OIE considered as 40 days for domestic horses. Pathogenesis is bite of insect takes virus into subcutaneous tissue, then migration to nearest lymph node and then to the systemic circulation. So they will be killing the cells present in the near area and the WBCs, mainly deposit on the heart walls and lungs along with the systemic deposition. Then the virus get localized in the places which produce the many lesions. The clinical signs are actually there are four principal main manifestations for this disease. Neural form is also present, and morbidity and mortality vary with the species of animal, the health status of the animal, the previous immunity, and the form of the disease. So first one is subclinical form. It is also known as horse sickness fever. Fever will be there. Generally, it is happening as a malaise, general malaise and depression, etc. So it is a mild form and death is very rare. And the second one is the subacute or the cardiac form. Dikkop is the another name for cardiac form. You can easily remind it dick, cardiac Dikkop, etc. Like fever will be there, high fever will be there, and mortality is usually 50% or higher. Swelling of the supraorbital fossa is a very, and the eyelids and neck region and the head region. It will be having a very amount of great swelling like happening. The third form is acute respiratory form, or the pulmonary form, which is known as Dunkop. Pulmonary we have N, so Dunkop we have N. Pulmonary Dunkop, like mainly Dunkop form, fever will be there, dyspnea will be there. Sometimes it can lead to aspiration pneumonia by inhalation of the nasal exudates. Nearly always fatal, like we'll be having aspiration pneumonia, bronchopneumonia, interstitial pneumonia, and the for dilated nostril we will be having the frothy fluid oozing out. Conjunctiva will be red and inflamed. The mixed form, which is the last form, which is not happening, which does not cause death. Both organs get damaged. Mortality is about 70 to 8% if not treated or greater, because when cardiac and pulmonary form together comes, they'll be having a very great mortality rate. Morbidity rate is less actually. Morbidity rate is less. Lesions in respiratory and cardiac, you can see the lesions, edema of the thoracic lymph node. The respiratory lesions will be mainly confined to the respiratory region, and in cardiac form will be between the cardiac region. Sometimes in both forms, whenever respiratory system and cardiac system is affected, as in the case of the mixed form, the death rate is increased due to asphyxia and myocardial infarction. This is pulmonary edema. You can see the edematous appearance of the lung. This is a congestion and catarrhal inflammation. You can see this is hemorrhage in the ligamentum nuchae. It's actually due to many virus getting bursted inside the cell, and that leads to the, also they replicate in between the skeletal muscle cells and produce many hemorrhage. This is the heart, and you can see the pericardial fluid, many petechias, and the lungs is always having a congestion appearance. So the intermuscular edema, pulmonary edema, I can see the pulmonary edema. Swelling of the supraorbital fossa is the main in lesion in pulmonary form and also in cardiac form. So the pulmonary edema, conjunctivitis, interlobar edema is very important factor. So this is like, see, you can see the frothy fluid coming out of the mouth, and this is the generalized malaise and depressed condition. This is the lingual petechia. You can see small lingual petechia. Now in mesentery, what happens is, since this is reovirus, this is respiratory and enteric orphan, it will be having hemorrhagic enteritis, and it can lead to hemorrhagic colitis, and they can even have colon infection, which can lead to. So the edema in lungs, the microscopic lesion. So the differential diagnosis, you have to rule out these diseases whenever we are going to find out whether the disease is African horse sickness. Diagnosis: virus isolation, virus identification, African horse sickness virus typing by VNT or RT-PCR, etc. We have to actually real-time PCR detects all the 9 serotypes. Prevention and control is immunity serotype specific, and 6-day quarantine measures are followed, and horses should be protected from the flies. Flies should be removed from the horse area. Vaccination is also done. These are the vaccines practiced. This is the practice of vaccination. These are the vaccination used. Normally in America, in India, in Assam, we use African horse sickness vaccine, and we practice it regularly though. Number of serotypes is 9, and the type of immunity is serotype specific. Thank you.